This week we're going to be talking about fixed prosthodontics, which is chapter 50 in your book. Last week I talked about removable prosthodontics. You know that removable entails the use of a partial or a denture to replace any missing teeth, and it does require that the patient take it in and out of the mouth. With fixed prosthodontics, it's often referred to as crown and bridge, and the key word here is going to be the word fixed. This is going to be something that's going to be a little bit more permanent. It gets cemented or bonded in and is not allowed to be removed. So once it's in the mouth, it's in the mouth. With fixed prosthodontics or even removable, you do know that it requires 3 additional years of training, whether it's at a university or a hospital-based program accredited by the ADA. And obviously the focus when it comes to prosthodontics is going to be developing or creating appliances or prosthesis that can either replace missing teeth or enhance teeth that are already in the mouth. Oftentimes, fixed prosthodontics can often be referred to as cosmetic dentistry, especially when we get into some of the indirect restorations that's entailed within the fixed prosthodontics section. So fixed prosthodontics, it's going to involve indirect restorations. We know we have 2 types of restorations in dentistry. We have direct and we have indirect. Direct restorations are going to be those restorations that are going to be done in the mouth, and that's going to be your amalgam, your composite fillings. Your indirect restorations are going to be fabricated outside of the mouth, usually sent to a lab, or it can be done with a milling machine if the office does maybe in-office crowns and bridges using a CAD/CAM system. So what are the different types of indirect restorations that falls under the fixed prosthodontics category? Well, the first one is going to be the crown, and you know that a crown is something that fits over the top of the anatomical portion of the crown. And the whole goal when it comes to prosthodontics, whether it's removable or fixed, is to make it look as natural as possible. You never want the, whether it's the crown or the denture or the partial, to stand out. You sort of want it to blend in with everything else because you don't want people to know that it's not real, that it was fabricated. So when it comes to doing a crown, the crown is going to be prepared, or the tooth is going to be prepared to accommodate something to fit over the top of it so that when it's placed over the top, it's not going to be bulky. And again, it's going to look like a tooth would look like. So the dentist is going to prepare the tooth, and you're going to notice that your premolars and anterior teeth are going to look a little bit more peg-shaped just because of the shape of them. The molar teeth are oftentimes just because they're going to be wider. They're not going to be, small enough to be peg-shaped because then we're going to get into the pulp chamber, which we want to avoid when we're doing any kind of a fixed prosthodontics or prosthesis as far as a bridge or a crown goes. So a little bit of the tooth structure is going to be removed, again, just to accommodate something to fit over the top of it. So the crown, once it gets made, it then gets placed over the top of it and it gets cemented in. And again, it matches the rest of the dentition that's in the mouth, looking very natural. Another type of indirect restoration is going to be a bridge. And a bridge is going to consist of components. It's going to have abutments and it's going to have a pontic or pontics. The abutments are going to be on either side of the pontic, and it's the anchor teeth. It's what gets cemented onto the prepared teeth on either side of the missing tooth. So on this model here, this patient or this mouth is missing tooth number 7. So we're going to do a bridge from number 6 to number 8. And this one's broken here. Number 8 is broken down, so it should look a little bit more like this. It's just broken down, so it looks a little bit funny. But this would be, in this case, a 3-unit bridge because it consists of, turn it the right way, 1 2, 3. Each of these components makes up a unit. So again, once the bridge, the teeth on either side are prepared, it allows for the crown to then, the bridge to get cemented into place, which then again matches the natural dentition, looking very natural. So again, the whole goal is to make this look like a tooth. Even though we're replacing a tooth, one is actually missing. We need it to resemble what the tooth looked like. And it's going to be done based on which tooth it is that we're replacing. So this is where the anatomy of the teeth are going to really come into play, because we need to know what the shape of each of the teeth are going to be to make sure that the appliance or the bridge or the crown is going to look natural. So that's another type of indirect restoration. We also have what would be a veneer. And a veneer is a very thin, shell-like piece of material. And the preparation for a veneer is going to be very minimal. Veneers are only going to be done on anterior teeth only, maxillary and mandibular. Just the way it's designed, it's so very thin that we can never do veneers on posterior teeth just because of the chewing forces that we apply on our posterior teeth. More than likely would break that off. So veneers only done on anterior teeth. Very little of the tooth is prepared. So unlike for a crown, only the facial portion of the tooth is sort of taken away. Oftentimes with veneers, it doesn't require a provisional or a temporary crown to be made. Just a little bit of the enamel is taken off. So usually the patient shouldn't be experiencing any sensitivity just because not a lot of tooth structure has been removed. And then again, this would get fit over the top of it, and this one would actually get bonded into place. So other types of restorations, I do want to show you a before and after picture here. With this picture, you can see that her teeth, there's some discoloration, there's some unevenness to it. By doing, more than likely in this case, veneers, they were able to even out these teeth and make them, look very realistic, look very natural, and they fit her face perfectly. And you can see that they're perfectly straight, as well as a lot of that discoloration is gone that probably really bothered the patient. So this is more so for aesthetics. These teeth, there's nothing wrong with these teeth other than the looks of them. So this is where fixed prosthodontics can be a little bit more cosmetic because we're trying to, give her more of a more appealing smile than what she had previously. So another type of indirect restoration is going to be inlays and onlays. Inlays are going to look very similar to a class 2 restoration, where it's going to include the occlusal and the interproximal, so a mesial or a distal, and it's going to be inlaid into the tooth. An onlay is going to cover one or more cusp of the teeth and kind of fit over the top of the occlusal, kind of like a hat would fit on our heads. So why, you're probably thinking, well, why not just do an amalgam or a composite filling? Well, there's going to be different reasons why. We may want to do more of an inlay or an onlay, and it's going to be based on maybe the amount of decay that might be present in the tooth. If the tooth, maybe the patient bit on something and broke off a cusp, rather than doing a whole entire full crown that's going to cover the entire portion of the tooth, the dentist opts to do an onlay instead. And I'm going to go through some different pictures here in a minute. One other thing I want to mention is the types of material that can be used for crowns. They can either be what would we consider gold. This would be a gold crown here. Let me put it back on this tooth here. So a tooth can be gold, and gold is going to be much more durable. So we often opt to do gold crowns on posterior teeth, just because they're going to withstand a lot of the wear and tear that we do, especially on our teeth. More so on males than on females, because males are going to have more power in their jaw, that they're more than likely going to have much stronger chewing forces than a woman can apply. So gold crowns are going to be a lot more durable and oftentimes recommended for posterior teeth. They are a little bit more expensive, and it often fluctuates depending on the price of gold at that time. And there's going to be different types. It's going to go from noble to semi-precious to precious, and that's just the amount of gold that's in the crown. We have something like a PFM, a porcelain fused to metal. It has a metal coping, so the entire crown is made of metal, and then it has a coating of porcelain that's placed over the top of it to make it look a little bit more natural. And again, these are going to be placed on anterior teeth, premolars, and oftentimes we can do porcelain or PFMs on posterior teeth as well. So it has the metal that's inside with the porcelain fused to the outside. So that is a PFM. Has metal and porcelain. What our veneers would be is considered more of a porcelain or a ceramic crown, an all ceramic. We can also make crowns that way as well. So rather than putting the metal in there, and the metal just kind of helps provide a little bit more stability to it, we can actually do an all ceramic or a porcelain jacket crown, where it's the whole entire crown is going to be made out of porcelain or ceramic. And these types of crowns are going to get bonded into place rather than cemented. So something that's going to be bonded requires the use of the curing light. And because the all ceramic crowns or the veneers don't have any metal, it allows for the curing light to shine through them because of their translucency. What does make it a little bit more challenging with all ceramic crowns is the stump that's left over from the preparation, whether it's a crown prep or a veneer prep, because oftentimes in a crown prep especially, a lot of the tooth structure is reduced down, and what's kind of left is a little bit of the dentin that's there, and we know that dentin is going to be a yellowish or darker in color. So because these are a little bit more translucent, the all ceramic crowns, it often, that stump shade or the stump, the tooth that it's going to then fit over, kind of shines through, making the crown look a little bit darker. That can be altered with the different types of bonding cement that we can use. The bonding cement comes in various shades, and we often will do a try-in just to kind of get the shade match to make sure that once it's in place, it's going to look natural. Because even though it looks good out of the mouth, when we place it onto that tooth, then that prepared tooth sometimes will come through, the color of it will come through. But that can be changed and altered with the cement that we use. We can also do what would be considered like a stainless steel crown. Stainless steel crowns are primarily used for children, primary teeth. They're not meant to be a permanent solution. Unlike your PFM, your gold crowns, your all ceramic crowns, those are meant to be permanent. Stainless steel are not, which is why they're primarily used for pediatric patients. So again, your inlay and onlay, they're going to be either gold, they can be porcelain, they can be ceramic, and it's all going to depend on, this one happens to be ceramic. Here we have inlays on both, on all three of these teeth. This is a distal occlusal. inlay. This is a mesial occlusal distal inlay, and this is a mesial occlusal inlay. Oftentimes, if the decay isn't that bad, or again, it just provides a little bit more stability to the tooth if we're doing more of a restoration, a fixed restoration versus a composite or amalgam. These are definitely going to last a lot longer. The disadvantage to inlays and onlays is that they're going to be a lot more expensive than doing an amalgam or composite filling. Here's what an onlay would look like. This one's showing an inlay. We can see because it's including the mesial, occlusal, and distal. So this is an inlay. It's inlaid in the tooth. And then this would be an onlay because it's replacing this cusp right here. Even though it's involving the mesial, it's also involving this would be the lingual portion right here. So that's why it's considered an onlay, because it's replacing one or more cusps, either on the buccal or the lingual surface. And again, it's going to depend on the dentist's preference, especially when it comes to an onlay. Like I mentioned before, if just a portion of the crown, maybe just one of the cusps broke off, it's a lot easier, less trauma to the tooth to be able to do an onlay than to do a full crown, because a full crown, remember, you're having to prepare the entire tooth all the way around, whereas with an onlay to replace a cusp, you're basically having to just replace one section of it, but it's still going to be with a ceramic or gold material that gets cemented in. So it's going to definitely last a lot longer, and it's going to be probably a little bit cheaper for the patient to opt for an onlay than a full crown at that point. So it's going to depend on the preparation and what the dentist sees as to whether or not they're wanting to do an inlay or an onlay. Again, talking a little bit about veneers. Direct veneers are going to be created out of composite resin directly into the mouth, which is why they're considered a direct veneer. The quality, obviously, of a direct veneer isn't going to be as great as you would get by doing it indirect, where it gets sent off to the lab to be created. But this kind of shows you kind of what it looks like. It's very, very thin and just fits over that facial portion of the tooth. Again, looking at the preparation of these veneers, very minimal preparation has been done. So again, to put a provisional or temporary crown over these is really not necessary. And then kind of a before and after with veneers, kind of give you a chance to kind of see what was going on. Two different patients here. This is showing you kind of what her teeth looked like before. They were a little bit shorter. Obviously, she wanted them to sort of match her face a little bit more. Obviously wanted them to be a lot wider, probably a little bit more straighter than what she had. So this was an option for her to do, was to probably bleach, especially some of the posterior teeth, and then create veneers to make the teeth look a little bit longer, a little bit more proportionate to her face. Here, same thing, we can see that the size really of the teeth didn't change other than making them a little bit more symmetrical, and also the shade. So this patient probably tried bleaching, wasn't able to get quite the result they were wanting, so they opted to do veneers, which is going to give them that kind of perfect smile that they probably have always wanted. So make sure you know what the different types of indirect restorations are and the different types of materials that each of these indirect restorations can be made of.